I think that if you are not caring for your mouth, your oral health, the best that you can, your dental health, then you might be missing the mark on the overall benefits to your whole body. I had a busy day trying to go to the dentist, get some work done, and it was really on my mind today, probably because I was at the dentist, to make a video about your oral health, this neglected part of us that we actually don't really associate with our whole body. Yes, you are in my bathroom because I wanted to swim a little upstream this January, and in this Back to Basics video, I want to talk about your oral health, why your oral health matters, the types of conditions you might face in menopause when it comes to your mouth, and at the end of the video, I'm going to talk about 2 things that you can do to soothe your mouth if you have any dry tissues. Because that's one of the top things that happens in menopause with the changes in hormones. Now, if we've not met before, I am Tanya, and I'm an ex-dental hygienist turned holistic nutritionist who loves to talk about all things menopause, whether it's something physical, emotional, or spiritual, because these are all the things that we seem to go through as we move through this age and stage. But I am hoping that you will stick around and subscribe so we can keep chatting. So let me know in the comments if you are struggling with anything like dry mouth, burning mouth syndrome, cavities, gum disease, bad breath. These are very common things at all our life stages that can creep up, but as we age with less saliva, we have changes in the microbiome of the mouth. These things can rear their ugly head, and a lot of women talk about sensitive teeth and dental pain. Now, I have started a whole series on dental health and oral health in menopause. I have a playlist started, I'll link that below, but we're just gonna touch on the real basics of why you actually need to pay a little more attention to brushing and flossing if you can, and I would even put that over rinsing and using a mouthwash. This feels really strange to be in my bathroom. Do you brush every day? A lot of people that I met when I was a dental hygienist didn't brush on a regular basis. And there were actually some of them that had good dental health. Why is that? It's because we all have a unique makeup of bacteria in our mouth. It's our oral microbiome that may or may not cause infections. And there's different types of bacteria that cause different things. There's particular bacteria that cause gum disease. There's particular bacteria that causes cavities. And there's some bacteria that hides on the tongue, the cheeks, and the back of the throat that can live happily with other bacteria, but at times it can become imbalanced and it may cause an issue. All I'm gonna ask you is to think about how you clean your mouth, how often you clean your mouth, and why you clean your mouth. And as I mentioned at the end of this video, I'm gonna give you a couple of tips to help you if you have dry mouth or burning mouth. It's on my list to make an entire video about burning mouth syndrome, and I will put that in the playlist about your dental health in menopause. This thing's bugging me. There we go. So whether you use an electric toothbrush or a manual toothbrush, what you are doing when you're brushing your teeth is, yes, clearing off bacteria. We have bacteria in our mouths that form all these colonies, and they're very, very sticky colonies. They're like little neighborhoods that hang around your teeth. In fact, bacteria love smooth surfaces. So whether you have teeth, an implant, a bridge, a crown, bacteria is going to accumulate around that, and if it sits there long enough, it can actually stink. When you are brushing and flossing, what you're doing is disturbing a biofilm of bacteria that can cause inflammation. Now, why is this important? You may or may not know that gum disease itself, when you have inflammation of your gums, can be linked to increased cardiovascular risk, an increased risk of blood sugar issues. There's a relationship between these 2 types of things and your gums. And when I was a practicing dental hygienist, I love to talk about this oral systemic link. There was a lot of research behind why inflamed gums or poor oral health could affect overall body health. So if you can't afford to go to a dentist, some of the things though that you do at home every day is going to be super important to keeping your dentition through menopause and beyond. The more you do to care for your mouth, it may also support your overall health as you age. When we are in menopause, we actually have less saliva. A lot of us start to lose our saliva, and that's because of medications. It is because of just the overall hormonal changes. Sometimes it's due to increased stress. A lot of women in menopause and perimenopause have increased stress, and stress can make you have dry mouth. You don't drop that saliva down as much. And this is why I really got interested in mindful eating practices, because they really work to regulate the nervous system. And when we're regulating the nervous system, we can start digestion. Digestion can start in that brain, help trigger saliva in the mouth, and that's what we need to help digest food. So the first thing you want to do is try and get into a regular brushing routine to remove any of that bacteria that can sit around the gums. Think of your gums like this little sweater sleeve. We want them nice and tight to the tooth, but when they inflame and swell, sometimes there's a little bit of bone loss around there and it leaves a little pocket where bacteria sits, and that toothbrush or floss can never get in there. All right, are you telling me that you have trouble flossing? My goodness, I've had so many people find it really, really hard to actually floss their teeth, and I felt bad for them because wrapping the floss around your fingers, having the mental acuity to understand where to put it in your mouth, even the dexterity, if you have arthritis, the dexterity to get in there is really tough. So there were lots of little tips and tricks that I would try to help people with so that they could get floss or anything in their mouth. It doesn't have to be floss. There's lots of interdental cleaners that at least get in there and clean between the tooth surfaces and decrease that bacteria. In fact, I had many people tie floss to the end of a toothbrush so that they could use that one finger and a toothbrush to get into their mouth. There's lots of tricks on the internet for stuff like that. Now, what does this have to do with things like burning mouth, dry mouth, cavities, and gum disease? Well, I already mentioned we want to decrease the bacterial load that is in the mouth so that you don't have the inflammation of the gums and cavities, but there is some link between bacteria in the mouth and that burning feeling that you can have when you go through menopause. Another link there is that with that decreased saliva, you can have more burning mouth, but you also have less ability to wash the plaque away, to actually neutralize acid from foods as well. So with a little more effort in the cleaning of your teeth, you can decrease that plaque accumulation and some of that acidic component of it because you may be lacking some saliva, and this will help counteract what can happen, the damage that can be done to the teeth and the gums because of our own bacteria. So if you struggle with cleaning your mouth, do the best you can. Try and put yourself on a schedule and think about it as exercise. Practice does help. I know it's tough to get these little pieces of floss in your mouth and wind them around your finger. I know it's tough. Do the best you can. Practice in the front. There's probably tons of videos on here showing you how to floss. Here's a couple of tips for you if you struggle with dry mouth or burning mouth in menopause. Okay, my first tip for you is ditching sodium lauryl sulfate toothpaste. There's a lot of big brand toothpaste that can irritate the mouth because of the foaming agents they have in there. I'm going to give you a couple of options. I have a couple in my bathroom. Let's see, can you actually see that? Burt's Bees. So I have Burt's Bees in my bathroom. This is a fluoride-free toothpaste that doesn't have sodium lauryl sulfate or sodium lauryl sulfate. That's a tongue twister, because sometimes if you have burning mouth, if you have dry mouth, those little foaming agents can be really irritating to your tissues. They're even irritating to my 22-year-old. She has a hard time using those types of toothpaste. And if you're opting for a fluoride-free toothpaste, this one is at the local drugstores here. It's called Remin. It is a fantastic toothpaste with the hydroxyapatite that actually puts mineral back in your tooth. A toothpaste like this helps remineralize your teeth. And what that is putting back mineral that might be lost from your tooth surface due to lower saliva, which means you might have more acid in your mouth and therefore more of an acid attack on your teeth so that you may get more cavities. This is just one of them. There's actually not a lot of great options that I can find in Canada. If you know of a great option in Canada, pop it in the comments below. I would love to try it and hear about it too. Actually, I'd have to hear about it first to try it. My second tip for you, if you actually have dry mouth, is to make sure that you're hydrated. I do have a back to basics video on hydration and how it helps your mouth and digestion, but it really is something that we overlook. If you're like me, you get up and you drink coffee in the morning. Maybe you forget your water. That lack of hydration contributes to lack of saliva. And the more we age, the more we need to keep that saliva flowing to protect our mouth. There are commercial toothpastes on the market that are there to help coat the mouth and coat your mucous membranes. Some people love them, some people don't. This one particularly has fluoride. And so if you don't want to use something like that, what can you do? If your dry mouth is very severe, I suggest that you talk to your doctor or your dentist. Sometimes your medications can be changed as far as the amount that you take, but a lot of times they can't. So your dentist will probably, and your dental hygienist will probably have solutions to help you with your dry mouth. But think of adding some things like chamomile tea to your day. Chamomile tea, licorice root tea, slippery elm, and even ginger tea can actually help soothe your tissues in your mouth. The one thing that you want to do if you have dry mouth is to kind of stay away from that acidy stuff like lemon and vinegar. I know a lot of holistic health circles want you to drink lemon and vinegar for digestion, but it's a fine balance between having good digestion and annihilating and wiping out your tooth enamel. For now, let me know if you struggle with the floss. Let me know if there's anything else you'd like me to expound upon here. Is that a word? In our dental health series below. And if this actually helped you, I think there's so many things that we can do to raise our physical health in menopause without dieting, and taking care of our mouths is imperative. And it's just one thing. It's one thing. So thanks for joining me in my bathroom. I hope to have you back again, but next time maybe I'll have you at the kitchen table for a cup of tea. I'll see you next time.